Michigan, how can we get out of the woods?
And find our way through this pandemic.
Oh, wait, you're frozen. So I can hug my grandbabies because I really miss them.
Celebrate my achievements.
Leah, sweetie, unmute yourself.
And get back in the classroom! So I can have a real senior year.
See clients in the office. I'm back.
Download the My COVID Alert app. Developed on the Apple Google framework, this app will send you a notification when you've been 6 feet from someone for at least 15 minutes who has tested positive.
It's free.
And completely anonymous.
Help us contain the virus and save lives.
So we can get back on the path to recital.
My kids.
Weddings. Can I set my date?
Travel. Shh. Is that a plane?
We can get through this, Michigan. Protect our community while knowing your privacy is 100% protected. Download the My COVID Alert app and spread hope, not COVID.
The wait is over. The all-new Umoja Radio Network, home to over 40 black-owned radio stations and podcasts, is here for you. Connect to the world's fastest-growing collection of unapologetically black and proud media, from podcasts to independent black-owned radio stations, and access to the important news and music you need. Umoja Radio is from our culture, by our culture, for our culture. The all-new Umoja Radio is available right now on Google Play and the Apple Store. Join the movement. Be empowered.
All right, family, welcome to the conversation. PA here with Big Rob. You doing okay, Big Rob?
Yes, sir.
Right.
Awesome.
Got the boss here, Kathy Moore. How you doing?
I'm doing good. How you guys doing?
Just fine.
Blacknificent. So what's happening this week? What's this modification reopening looking like?
Well, the governor, starting tomorrow through January 15th, the governor has lifted some of the restrictions. And so high schools are open, or high schools can open, and theaters, bowling alleys, casinos with limitations. So people still have to wear the mask, and she has a capacity limitation of 100, and then no concessions at the movie theaters and other places.
So 100 at the casino?
You know, that could be based on a capacity, but I'm just looking, it said 100, but that could be an example.
Okay. All right.
Yeah.
So, what about restaurants?
Restaurants are still closed for indoor dining and open for outdoor dining or takeout, carry out.
Now, I saw something that said entertainment venues. That mean that clubs can be open?
Yes, if people can still wear their mask, and there is, of course, there's limitations related to that.
Okay, so they can party for New Year's.
Yeah, with limitations, absolutely. No food.
No food?
It's only in places where people do not have to take off their masks. So the movies, the bowling alleys, she's saying, you still got to wear your mask. So, I don't know how much partying they can do with a mask on, but it's possible.
They probably figured it. Who's gonna be out? Y'all, we don't have the COVID police, so
that's true.
I know you got too much other stuff to be worrying about.
Absolutely.
Checking in on nightclubs and stuff.
Right.
Are there any fines though if they do violate those things?
They just sent us something on Friday night that told us, first as public health, we're supposed to issue a cease and desist order, and then we would send that information to LARA, which is the licensing and regulatory authority at the state. and then they would go from there.
Oh, they going after them license. The
They
liquor
would,
license.
yeah, they're going after the licenses.
Okay, so how are our numbers here? How are we looking?
So we're still seeing positive cases, but the surge that we thought was going to come after Thanksgiving did not come, and we are gradually going down. So
Good.
while we're still higher than we were in April and May, I am very happy with our residents and our behaviors, and we're going down. So it's going in the right direction.
Rob, go ahead, brother. I know you have some things you want to ask.
No, that's wonderful to hear. What about our death rates? Are they going down as far as this COVID is concerned in our bed space for the hospital here?
So death rates are still disproportionately high, especially in the older population. So the older you get, the higher the death rates. We're still seeing that disproportionately. And so unfortunately, when individuals past a certain age and or with underlying health conditions, their risk of severity with COVID-19 increases. So we still need to really, really take precaution if we're going to be around our loved ones who are older and or have underlying health conditions. And then, we as a people, we don't really tell people our health business. Like, we could be around people, even our family, with underlying health conditions. So we still have to be careful because, grandma not going to tell everybody her business.
No.
Right. I get you on
No,
that.
she's not.
So the vaccine did arrive in Muskegon County this past week.
Yes.
I saw the press release on that. Did they complete all the healthcare workers?
No, they started on Friday. And so they just started and they're still going through this weekend. They have a really good plan because you shouldn't vaccinate everybody at once, just in case there are some contraindications, so that everybody doesn't, call in at once. And so they are strategically making it happen.
Right. If you're watching online, if you got any questions for Kathy Moore, please, you can go ahead and type those questions in.
So Rob also asked about hospital capacity, and hospital capacity have been managed and it's stabilized. So we were really concerned with the surge pre-Thanksgiving. And it was really, it was really stretching the hospital capacity. But since that time, the number of COVID-19 patients have also steadily declined, and the number of people on ICU and ventilation has declined. And so the hospital capacity situation is very stabilized, and they have a plan for a surge if it happens again, so that it's not taking beds away from other illnesses like heart attacks and things like that.
So high schools can resume in classroom sessions now?
Yep, they can beginning tomorrow. Interesting though, a lot of schools will be on Christmas break beginning tomorrow. But if they're not, high school can return.
Okay. Are there any numbers you want to share with us? Anything you want to share?
Just, the numbers just keep gradually going up, but nothing extraordinary. Our highest age group for the positive cases are still age 50 to 59. And again, that's because that's a hard working age group. They're in positions of leadership, and they're taking care of parents, kids, grandkids, just a lot of obligations, work and personal. And then the second highest age group is age 20 to 29. And that age group is a little more social than the 50 to 59, but they also have those entry level type jobs where they still have to get out and work. So a similar obligation, but one is their job, and then their social life. They don't want to give that up.
Right. Kathy, what kind of suggestions can you give to people they're gonna gather for Christmas? You know that, right?
Yeah.
It's kind of hard. They're gonna party for Christmas. So
Yeah.
what can they do in spite of having 10 or 15 people at the house? What can they do to maybe mitigate the chance of
Just please keep your social circle small, so that if you do end up, getting sick, testing positive, you have a smaller group of people and a smaller level of guilt when you call them and tell them that you've been diagnosed as positive. So keep your social circle small. Exceptional hand washing. So wash your hands as much as and as often as possible. Keep some lotion with you because I know how our hands can dry out in the winter, but wash your hands as much as possible and still wear the mask. I mean, I don't know if it has to say ho, 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 or it look like a Santa Claus beard, but mask.
Now, Kathy, what have you heard much on this other strand of COVID that has closed down the borders of the UK?
I've heard probably just as much as you, Rob, that they are identifying a more aggressive strand, but we felt that this second surge was more aggressive as well. And we don't know if that's the same strand, but we do know that more people, more close contacts had tested positive, and more people had symptoms. A lot of the symptoms lasted longer than what we thought, the 10 days. And people started feeling better, and then boom, they felt weak again. And so we don't know if that's the same strand in Muskegon County. We do know scientists in Michigan identified 3 different strands. But this new one, we're not sure yet.
the vaccine can handle all those different strains?
Again, it's emergency use authorization, and they have tested it to the best of their ability. So we don't know if the COVID-19 is mutating, if that strand is mutating. But so far, when it was released, that vaccine could handle all the strands that had been identified.
Wow. Now, there are countries like Cuba and I think New Zealand where they have declared that they had eradicated this virus. Do we know what they did so different there?
Some of the places, even like Australia, they are saying that they just really enforced the same 3 mitigation, the mask, the social distancing. They had some stay home orders, but even when people got out, they did not, they just didn't violate those mitigation efforts. So just a group of extremely obedient residents.
Right. Do you expect to see more rapid testing available here in Muskegon?
Absolutely.
Do you know? I mean, because I've been trying to find. I'm getting ready to travel, and I've been trying to find somewhere where I can take this test here locally.
So, did you try Christ Temple Church
for rapid testing? I mean, like when you get your results in like 15 minutes.
15 minutes. No, not yet, Paul. But wow, had I known, not yet. So we have ordered more, and we've ordered an additional machine so we can enhance that. And we really want to help the schools as they reopen, get more rapid testing in so that we can, isolate people right away or quarantine them if they need to be.
So you can see that happening at the schools. Yeah.
Yep, we're working with the schools, and we really want to get that implemented there, so that we can finish out this school year without interruptions.
So do we know how long this vaccine will protect us?
We don't. So we don't. We know that, the natural immunity for the people who have already been diagnosed with COVID-19 is approximately 90 days. We don't know how long this vaccine, both the Pfizer and Moderna, but they do say it is at least that long, that 90-day and longer. But no, they don't know for sure.
All right. We're seeing a lot of Black people on TV. You got a lot of Black people on TV taking the vaccine.
Yeah.
You got a lot of Black doctors and scientists who are working at the CDC. CDC's in Atlanta. What are your thoughts? Have we evolved as a science and medicine? Do you think it's possible for another Tuskegee to happen?
I don't think so. I mean, I think we have evolved, and we have a lot of Black African Americans in charge in leadership positions that they absolutely would not allow that to happen. I can't say in other countries, but here in the United States, I think we have, we've evolved to a point where that there's no way that could happen. Just not deliberately, no.
Right. Rob, anything before we go?
Oh no,
Okay, Kathy, anything else you want to share?
Just, the holidays coming up. We know it's Christmas. We know it's New Year's, and we know that we don't want this to go on all through 2021. So, just my plea with everyone, if we could just stay our distance, keep our social circle small. Vaccines are starting to roll out. We think by April, everyone who wants one will have an opportunity to be vaccinated. So if we could just still practice as safely as possible, or keep our social gatherings as safe as possible, so that we don't go the other way. That's all.
All right. This is our last update of the year, because we won't be around next week, and I know you're going to be enjoying yourself too.
I hope.
So, right, unless there's an emergency, I won't be bugging you at all. And so,
Okay.
I hope you and the family have a happy holidays and a great New Year. Okay.
Yes, you guys too.
Thank you so much. We had a question online. Do you want
Absolutely.
want to take this question here, Rob? You want to take this question?
Do you think the children will return to school this year or next fall? Physically, I guess they're saying being in school.
I don't know, because it's really up to the school boards to make that decision. The real concern is just making sure that the schools have the capacity. So sometimes, or in some school districts, the staffing level is so skeletal that, with 2 or 3 absences, or like if 2 or 3 teachers had to quarantine for 14 days, that basically renders that class almost ineffective. And so there's so many different metrics that they have to check into. So I can't say for sure.
All right. Good question. Thank you, Treasurer X, for that question. All right, Kathy, thank you so much. And once again, happy holidays to you, okay?
Okay, take care, guys.
Right.
Yeah.